Thank you, Chairman. Good afternoon, ladies and gentlemen. My name is Chenghao from Beijing, China. Today my topic is about the different NAS procedure for pectus excavatum after surgery of congenital cardiac surgery. After congenital cardiac surgery, some children may develop pectus excavatum or worsening of pre-existing pectus conditions. The NAS procedure poses some risks of cardiac injury, which could be elevated by the retrosternal adhesion after congenital heart disease. So it is very important to study how to safely conduct NAS procedure in these patients. So we retrospectively review the patients from 2003 to 2016, and 49 cases were enrolled in our study. There were 29 male patients and 20 females. The mean age was nearly 6 years old, and the mean health index was nearly 5, and all patients received the CT and echocardiography pre-operatively. The interval between the cardiac surgery and pectus surgery was about 4 years. And we based on the endoscopic observation of the inferior thoracic cavity and the retrosternal adhesion, and together with the CT and echo results, the following 3 surgical techniques were adopted. And the technique 1 was standard 3-incision NAS procedure. And technique 2 was NAS procedure assisted with a small incision in the front chest. And technique 3 was NAS procedure with sternal suspension technique. That means the supporting bar was implanted into the anterior thoracic wall submuscularly, and the sternum was sutured using stainless steel wires, and the depressed thoracic wall was elevated and fixed on the supporting bar. All the patients were successfully completed, and no mortality. The mean operation time was about 45 minutes, and the hospital stay was about 6 days. Out of the 49 patients, 94% were excellent. And we have 3 patients had severe complications, and 1 patient had a pericardium injury, and 2 patients had right atrium injury. And here's the detailed information. And we have 1 of the heart injury patients. We turned the surgery from assisted incision to the suspension technique. And here we listed a checklist that we recommended what we need to prepare before surgery. And the detailed history is most important, and the image of chest CT and echo, and the blood bank, and blood pressure monitoring, and multiple IV access, and cardiopulmonary bypass equipment, and inguinal region preparation, and cardiac surgeon standby. And here we listed a flowchart to explain our strategies. A history of interventional cardiac procedure for CHD or patients without severe post-operative atrial adhesion after lateral or median thoracotomy was indicated for procedure 1. And patients with severe thoracic adhesion on the thoracoscopy and with difficulties in adhesion separation were indicated for the procedure 2. And when the adhesion was difficult to separate, or if hemorrhage occurred during the separation, the complete separation of the retrosternal adhesion would not be necessary, and instead we conducted the procedure 3. So the conclusions: detailed history and pre-operative preparation are very important. And the standard NAS technique can be applied in several specific situations of pectus excavatum after the congenital cardiac surgery. And otherwise, the assisted incision was strongly recommended. And the suspension technique was advised if the separation was difficult or bleeding occurred in the surgery. And an individualized surgical plan will increase safety and decrease the risk of the surgery. That's all. Thanks so much for your attention.